How do we deal with ethical dilemmas in reality? Rosenberg and Schwartz brought a 6-step process for ethical decision making in this article. We will discuss this in more detail within a scenario. John works as a BCBA providing early intervention services for children with autism in a low-income, rural area. He is the only BCBA within a 160-kilometer radius of his office. Recently, John's neighbor, a single mother 3 houses down, has a 2-year-old boy just diagnosed with autism. The family's pediatrician referred the family to John for ABA services. John is struggling with how to handle the situation. According to the ethical decision-making process from Rosenberg and Schwartz in 2019, the first step, John will identify why it is an ethical dilemma. In this scenario, he is struggling on whether he should accept his neighbor's son as a client. If yes, it will result in a multiple relationship. Then, who are the clients? That boy and his family are the clients. When reviewing the BACB code, John thought of the code 1.06a. Due to the potentially harmful effects of multiple relationships, behavior analysts avoid multiple relationships. And the code 2.0, behavior analysts have a responsibility to operate in the best interests of the clients. These are the most relevant to this scenario. Finally, John considers his value and bias. He was committed to serving underserved populations, so he chose to live in this low-income rural area. He feels disdain for those rules and regulations that are made by people who do not understand the conditions he is operating under. He tries to guard against it, but he also wants to make sure he's carefully considering why the rules exist and the dangers if they are not followed. So, he brainstorms solutions. John considers what solutions the BACB code suggests and whether there are other possible solutions. The BACB code suggests John should avoid this multiple relationship and refer the family elsewhere. Another possible solution is to take the family as a client, but to try to set up safeguards against the dangers of the multiple relationship. Then move on to step 3. Evaluate solutions. John needs to consider what issues, conflicts, or tensions might potentially influence each solution. He must also consider the following factors when evaluating solutions: client safety, client dignity and self-determination, client outcomes, and any impacts on the relationships with other parties, or the family preferences. For solution 1, refer the family elsewhere. John is the only BCBA for 160 kilometers. The family has very limited financial means. They are unable to afford a distant BCBA who is willing to travel to their small town to provide services. Therefore, it is not feasible. In addition, John can try to find a remote BCBA who is willing to provide services via telehealth, but John knows this family does not have good internet service, which may not be feasible as well. Solution 2, accepting the child as a client. Set up a procedure to mitigate the potential problem of multiple relationships, including discuss the situation and the dangers of multiple relationships with the mother, for example. During the session, John will avoid any social encounters with this family as much as possible. If encounters occur unexpectedly, they will not discuss the child or his treatment at all. Also, if unexpected neighborhood issues are to arise that requires attention, the mother will interact with John's wife about these issues rather than John. This solution looks feasible. After evaluating the possible solutions, John will move on to step 4, finding an acceptable solution. If he cannot find one, he'll go back to step 2 to brainstorm again. Although John is uncomfortable stepping knowingly into a multiple relationship, he decides it is in the client's best interest to receive ABA services versus no services, and implementing safeguards against multiple relationships is an acceptable solution. Then, after John finds an acceptable solution, he moves on to step 5, Implement the solution with fidelity and carefully document all actions taken. John knows he is acting against a rule. He wants to document his careful weighing of the pros and cons of different possibilities. Then he writes up a clear list of the parameters he has developed for the relationship and uses this in his conversation with the mother and keeps it within his documentation of his decision-making process. Finally, John moves towards to meeting the mother. After implementing the solution, John will reflect on the effects of his decision. 6 months later, he will ask himself, was it a successful resolution? Do I need to take any further steps in this particular situation? Have I learned anything that would affect future ethical decisions? John reflects on his decision and its consequences. There is no question that the child has benefited hugely from ABA therapy. He is making great progress, starting to talk, developing play skills, and learning self-care. John also feels that he has safely navigated the multiple relationship. He and the mother rarely see each other outside of the clinic, and they keep those interactions brief, effectively avoiding discussion about child services. John does feel that the situation has affected his life in the neighborhood a bit. He now always checks to make sure the family is not outside if he goes out to take a walk, and he chose not to attend the neighborhood barbecue last month so that he would not run into the family. But he feels that these are small, personal inconveniences compared to the good he's doing in providing the child with life-changing therapy. Overall, he feels extremely positive about the choice he made and its impact on the affected parties.